Hello friends, welcome to my channel Maths Simply Learn. In today's video, I will be discussing about CA 19.9, which is an important tumor marker. So what is CA 19.9? Also known as carbohydrate antigen 19.9. It is a glycoprotein and it is the sialylated Lewis A antigen, which is a type of a blood group antigen seen in certain individuals. And this CA 19.9 is produced by the pancreatic and biliary epithelial cells. And while it is present in small amounts in healthy individuals, it is also found on the surface of certain cancer cells, thus linking it to the tumor biology. So what is the physiological role of CA 19.9? It has a role in the cell adhesion. It facilitates cell interactions and communication in the tissues. Regarding its role in the tumor biology, it contributes to tumor metastasis by aiding the cellular migration. And its genetic regulation is influenced by the FUT3 gene, which is related to the Lewis blood group antigen. So what is the clinical significance of CA 19.9? It is mainly associated with pancreatic adenocarcinoma, elevated in 70 to 85% of these patients, and in these patients used to monitor the response to the treatment, diagnosis, as well as detect the recurrence of the tumor or the cancer. And the levels are above 37 units per ml is considered as elevated value. Limitation include it is not effective in the screening of the cancer. Other cancers where elevated CA 19.9 levels are seen are cancers of biliary tract like cholangiocarcinoma, gallbladder cancer, then gastric cancer, colorectal cancer, and ovarian cancer. There are certain non-cancerous conditions also where there is elevated levels of CA 19.9 like bile duct inflammation or cholangitis, pancreatic inflammation or pancreatitis, liver cirrhosis, cystic fibrosis, benign biliary obstruction, and inflammatory bowel disease. Coming to the interpretation of CA 19.9 results, in those cases where it is a known case, we should establish the baseline measurement before the initiation of treatment so that we can monitor the changes over time and thus help to detect the recurrence or the response to the treatment. While in the new cases for the diagnosis, we should correlate the levels of CA 19.9 with the various imaging methods and interpret the results alongside the symptoms and the history of the patient. Finally, the limitations of CA 19.9, it has low sensitivity, so cannot be used for early stage cancer detection. False positives are seen, that is, it can be raised in various benign conditions, and in Lewis negative people, it is not produced, and moreover, it cannot be used for a screening of the cancer. So this is about CA 19.9, its significance and limitations along with the interpretations. Thanks for watching.